Hello, co-journeyers, and welcome back to The Truth So Help Me Good. I am your host, Barbara Landry, and together we continue to explore some of the bigger questions about this journey we call life. Today, my special guest is Dr. Carolyn Larkin Taylor. She is a board-certified neurologist with over 30 years of experience in general neurology. After growing up in Spring Lake, New Jersey, she was among the first women to graduate from University of Notre Dame. She later moved to Philadelphia, where she obtained her MD from Hahnemann Medical School and completed a medicine internship at the Medical College of Pennsylvania. Finished her neurology residency at the University of Pennsylvania. And while in Philadelphia, she received the Humaneness in Medicine Award from the Philadelphia Medical Society. She was named as one of Philadelphia Magazine's top doctors for women. And today she joins me to talk about her book, Whispers of the Mind, a neurologist's memoir. Welcome, Dr. Taylor.
Thank you so much. That was a beautiful welcome.
Well, I'm so happy to have you here with me today to discuss this amazing book. Um, your book takes us on your journey as a woman, as a human being, and
Yeah.
as a neurologist. So I want to start by asking you, how did you choose becoming a neurologist? Was it a calling for you? How did you come to follow that path?
I consider it a calling. I wanted to be a physician very badly. And I think when you go into medicine, you have all these ideas, do I want to be a pediatrician, gynecologist, whatever. And I had decided I thought I wanted to be an ophthalmologist. Um, and when I rotated, it was a requirement in my medical school that as a third year medical student, you rotated through neurology for a month. And I was inspired. I just fell in love with it. We had one of the most famous neurologists there who was leading the rotation that particular month. It was just coincidence that that happened to be his month. It was Elliot Mancall.
Mm.
And he was inspiring. And I loved every minute of neurology. I couldn't wait to go there every day. I went and bought the textbook, Adams and Victor textbook of neurology, and read it from cover to cover that month. I never did that really with any other rotation. I read required readings, but I couldn't get enough of it. And I just realized that this is what I had to do. I really fell in love with the whole field of neurology, the
Mm.
anatomy, the complexity of it, the fact that it combined body and mind in some way, body and brain and emotions, um, and the human connection. Because as a neurologist, as opposed to a surgeon, for instance,
Right.
you are kind of married to your patient for a long period of time because neurologic disease is rarely cured. It's often neurodegenerative. And so you're with the patient from the time you diagnose them until their end or your end.
Mm.
And I like that human connection.
Mm. Mm.
So it's one of those fields in medicine where you either love neurology or you hate it.
Right.
And most medical students hate neurology because it's a complex field and it requires a detailed knowledge of neuroanatomy that some people hate, and some people, like me, I just really loved it. So, also, I can recall so many other students saying, "Why are you going into neurology? All they can do is give someone aspirin or steroids. They can't really help anybody." And of
Mm.
course, that's not true.
Right.
But that was the impression that people got because you consult a neurologist in the hospital and they'd leave their recommendations, and it would be, well, maybe steroids, maybe aspirin, or, there's no meaningful recovery here. And so you kind of get that opinion if you don't really dive into neurology. But
Right.
especially today, there's so much we can do. But
So
I was
we
fascinated by it in a way I was not fascinated by anything else.
So I think the medical field gets a bad rap in terms of medical training and connecting with patients. So when you talk about the human connection of neurology, is that something that medical school itself prepared you for, or is that something that you more cultivated on your own through your experience as a neurologist?
Well, I'd say some of it's personality driven. I like to say there's a surgeon's personality and there's a dermatology personality. Um, People that tend to go into those fields, let's just say surgery, they like to use their hands, they like to have a solution to a problem and then move on to the next problem. There are other personalities that really like to connect more with people. People that go into the cognitive specialties such as oncology, neurology, rheumatology, they're more um, thoughtful and engaging in terms of their personality. I think they like to know a little bit more about the person. Um, so I think it's to some extent it's personality
Right.
driven.
Oh, that's really
Um,
interesting. Yeah, I hadn't
yeah,
thought of it that way.
yeah.
So you dedicate your book to your mother, Jeanette Wicks Larkin, who you
Yes.
describe as your greatest inspiration and source of inner strength. So I wanted to ask you about that so you can explain to us in what ways she was that for you.
She was an incredible, bright spirit and human being. I was so lucky to have been raised by her.
Mm.
My father left my mother with four young children. When I was four, I was the youngest,
Oh.
and she was alone in life. She had grown up very wealthy and privileged, and um, that all went by the wayside. And she married my father, who was not really capable of handling the responsibility of a family for reasons of his own. He wasn't a bad person, but he suffered, in hindsight, he suffered from depression
Mm.
and couldn't handle it. And so my mother was just left. There was no word. Didn't know where he was. He just completely left. There was no child support or
Mm.
help from any relatives except my grandmother, my mother's mother, who moved in with us and helped take care of us. My mother went out to work every day. And so she supported four children all by herself. She never married. She had no time for a social life. And she did it with optimism and intelligence and humor, and always made us feel safe and secure, and brought us up to be strong and to believe that whatever we wanted to do in life, if we wanted it bad enough, we could achieve it and do it.
Mm.
I put myself entirely through college and medical school, and I never questioned would I be able to do that. I just had confidence that I would find a way,
Mm.
and I did. A lot of student loans, some scholarship, but it's a long road, but it was something that I was inspired to do if I wanted to.
Mm.
Um, and I recall her saying to me when I told her I wanted to be a doctor, well, that's a very hard life because her father was a doctor. So she said, I know from growing up, my father missed so much, and I missed him for this occasion and that occasion. Um, that you really should think about it very, very carefully. She wasn't pushing me at all.
Right.
And then I can recall calling her in the middle of the night when I was an intern on call, and I had a young baby at home. And I just cried and said, I can't do this anymore. I miss Rory so much. And I didn't realize when I went into this how hard it was going to be. And this is a woman who told me how hard it was going to be
Yes.
beforehand and asked me to really think about it carefully. And I said, I think I just can't. I have 4 years ahead of me more. I don't think I can do it. It was one of those moments. And I remember her saying to me, you can. And you need him much more than he needs you right now. He's
Right.
fine. And when you're an established physician and have a career and can choose your own hours and really be there for him, any financial needs he needs or anything else he needs in the future, you'll be able to do that. And he's going to need you much, much more.
Yeah.
when he's older. And he did. And she was so right. I mean,
Wow.
this is a woman that worked as a legal secretary and had to take care of 4 children and somehow get them through college and life and encourage them. And she knew I'd have more means for this one child that I had. And boy, did he need it.
Mhm.
So, she was an inspiration in every way. And her sense of humor was just incredible. And I tell a story, um, one of my essays, and it's a book of essays that deal with patient, true life patient stories that illustrated some aspect of human nature. And there was also some personal stories that I lived through that had to do with neurology and how I developed as a person and as a human being who dealt with grief of my own and devastating medical challenges in my own family. When my mother was in an intensive care unit on a respirator, she had the nurses put a sign above her head. I went into the hospital to see her, and I just had to burst out laughing. Sign above her head that said, "Every day above ground is a good day."
Yes.
She just wanted to bring joy and laughter to people that came in to see her and were taking care of her, and she scribbled jokes to them on a piece of paper, and she was just that kind of a spirit.
Amazing.
She was inspiring. She inspired me, and I still look to her after all these years, um, since she's been gone, to inspire me. I think, what would mom do? And
Right.
I know what she would do. I know what she would say. And now instead of crying, I can laugh because, that is over. The devastating grief is over.
Yeah.
But and her gift to me in her final days, this was a gift as well, was to help me in my earliest stages of my career. I was in my 3rd week of neurology residency when she died. Um, Her gift was helping me become a more compassionate physician as I dealt with people, with families in the hospital whose parents had had a stroke and they were on a respirator and dealing with end of life decisions like we had to with my mother.
Yes.
I had lived it
Yes.
and I knew
Wow.
how they felt, and I could bring that compassion to my patients. And that was a final gift that
Wow.
she gave me. And
Mm,
I always like to think of her that way.
remarkable. Yeah.
Yeah,
Thank you so much for that. Thank you so much for that.
you're welcome.
Ah, so the title, Whispers of the Mind. How and why did you choose that and what exactly does it mean?
Well, I like to think of it as whispers is our intuition.
Okay.
We have our brain and body and our mind. Our brain is kind of the hard drive of a computer, but our mind is the consciousness that tells it what to do, what we want it to do. Um, and whispers are those unspoken, not spoken out loud things that we sense and that we know when you're seeing a patient and they come to you with a problem. At least in the field of neurology that I know most about, it's often not what they're really there for. They might be there about a headache, but what's really bothering them are maybe the twitches in their muscles and they fear they might have ALS, or they're really, dealing with some trauma in their life. And that's one of the reasons their headache just never gets better. And you have to really listen to them and read between the lines and understand what's going on. And when your answers don't satisfy them, there's a reason, and it's
Right.
usually you haven't gotten to what it really is.
You haven't asked the right questions yet.
Right. So
Yeah.
the whispers are your intuition and what is not said out loud, and they're coming more from the mind than from really the body.
Hmm. Wow. So you did say that your book is a book of essays. How would you describe how it is written? Can you just tell us a little bit more about the format and why you chose to write it the way you did as essays?
Well, my coping mechanism throughout my journey in medicine, and training and beyond, was to journal. Some people have people that they talk to, some people see a therapist when they have to deal with the complexities of life and sad encounters. But I was busy, and so I journaled, and it was a way I could, at times when I couldn't sleep, when I would be thinking about this patient or that patient or what I had done that day or what had happened, and I couldn't sleep, I would get up and I would write it down, longhand. Um, and later on, I started typing on a computer, but it was my way of taking it out of here and putting it here
Mhm.
so that I could go to sleep. And it was a wonderful coping mechanism, better for me than meditating or anything else I could have done. And so I had all these stories. And when I finally had some time in semi-retirement, I was reading through them. And I was inspired myself by remembering some of these stories and these incredible people, the resilience of some of these people that I dealt with that had truly devastating illnesses, but were just remarkable spirits. And I could also see, looking through these years, how I transformed as a human being and as a physician and how I grew and what my patients taught me.
Right.
And I decided I was going to write them down in a literary format because I thought that it could be inspiring. The stories, the real heroes are the patients in my stories,
Mm.
but it's not so much about neurologic illness as it is about the grief and hope um, that connect us all and how resilient the human spirit is more than we ever knew, more than I ever knew,
Right.
looking at the cases of these patients. So I'm not trying to teach neurologic disease, but I think there's such a each story is very varied, and I tried to put in something that illustrated different aspects of life that would appeal to anyone. There's something in there for everyone, whether it's medical gaslighting or one form of addiction or another, or dealing with death with dignity, or
Right.
coping with the illness of a family member, or just dealing with child that you have that's an athlete that has a concussion and how families tend to or parents can sometimes tend to be complicit in um, putting the child back on the field when maybe they shouldn't be back on the
Mm.
field. And
Yeah.
so I think from the people I've talked to since it's been published too, everyone has said to me, "Oh, I really got something out of this story," or "My favorite story was the other one because I could really relate to it." And I think for everyone reading this, there's something in there that they can relate to. And if you can
Definitely.
relate to a story, then it teaches you something because it's not just reading about Parkinson's disease in an encyclopedia, it is relating to someone who has Parkinson's disease. And that's how we can actually learn and see that um, we're all much more alike than we are different.
Yes, absolutely. Absolutely. And to be able to see people in challenging situations helps teach us what is possible in terms of our own resilience.
Yes,
Because I did, it was scary. They were reading the book, hearing about some of these diseases. A lot of them we are familiar with and probably keep at a distance if we have the choice.
yes,
And thinking about because, but I think, and this gets into some bigger issues, just in terms of as human beings being willing to lean in general to some of the things that are more difficult, because as you said, it helps teach us about what we're capable of and what is possible, and also um, allows us the opportunity, if we're willing to take it, to come to terms with some of our limitations, including our own mortality.
yes,
So great value for all those reasons, the stories that you've shared. What, and this is probably a hard question because there may be many things, but if you could boil it down to one biggest challenge of being a neurologist, What would you say your biggest challenge was, or one of them?
I'd say the biggest challenge is the fact that you rarely cure anybody.
Okay.
Um, you manage conditions and you accompany patients on their journey. Um, but you want so much as a physician to cure someone, to just make them better. And learning over time, and this took time, that you do make them better just because you're there and you listen.
Mm-hmm.
And you can't change the fact that they have ALS or they had a devastating stroke and they're never going to be the same, or that there's been a devastating spinal cord injury, but you can listen to them and do whatever you can to make their life more meaningful and palliative. Um, and there are some people that you really can help, and that's very satisfying. The patient with MS, there's so many drugs now that help regulate the immune system, and you can assure or almost assure someone at the beginning of their journey, if you get them early, that you can treat them aggressively and they probably will not have any significant disability over time.
Yes.
You can help people with migraine. You can help people with epilepsy manage their seizures. You can't take them away,
Yes.
and they still wish they didn't have to take medication. But there's very few cures, and I think that's the most difficult thing in neurology. But in the same token, it's satisfying to be able to be the one to understand and to listen to them because in our society, people don't want to acknowledge mortality. They don't like to talk about illness, especially if it touches them. Um, Eh, but so I find that just being there and being the one that they can come to and say, I can't talk to my family because they keep changing the subject, or they assure me that it's going to get better or someone's going to find a cure,
Yeah.
but you will at least listen and you understand,
Yes.
what the risks are, and they feel comfortable in that space of being able to talk to you.
Yes. And I've heard the distinction made between healing and a cure, and that healing can occur even when the result is death, that curing has to do with prolonging life, but that doesn't mean that healing doesn't occur in the
Right.
process. Does that make sense?
That's a beautiful way of putting it. I haven't heard that.
I didn't
It's
come up
really
with that, but yeah,
That's
I thought that
beautiful.
was, yeah, it's a powerful distinction because I think we're so focused on life at all costs that
Yes.
sometimes we miss the fact that healing can occur even when the end result is death.
Yes. And that's what it's all about when you're dealing in the health professions in any capacity is being there and listen and being present and listening and
Yes.
offering compassion and support. And that goes a long way. And touching the patient, putting your hand on their shoulder or letting them cry. I think that goes a long way towards healing.
Hmm.
It's
Yes.
it's a beautiful
Yes.
thought.
You discuss in your book, and I was so I really loved the honesty in your book in terms of calling everything like it actually was, including some of the experiences of just the medical profession, the facilities themselves. I mean, this is not a perfect world, and you
No,
were very open about that, which I think is so important. And that was scary too. It's like, oh my gosh. But I think reality, the truth of things is an important thing to
yeah,
face because there's no value in not, at least from my perspective. So I
yes.
appreciate you doing that. And one of the things you talked about was that in your training as a doctor, you had learned to compartmentalize your feelings.
Mhm.
Um, and you've talked about this a little bit already, but in what ways was that useful in terms of being able to carry out your role as a neurologist? And in what way did it create obstacles, that
It was
compartmentalization?
it was very useful. as a neurologist because, for instance, when you're rounding in the hospital, when you do hospital neurology is very different from outpatient neurology because people that you get consulted on in the hospital are often devastating injuries, strokes, brain death exam after an overdose. Um, Sometimes you're consulted for help manage medications in a Parkinson patient that's perioperative, or a mental status change. But a lot of it, I'd say 50% of it is something very, very serious that will affect you as a person.
Mm.
And, if you get 10 or 15 consults in a day and 5 or 6 of them are some devastating event, how do you go on to the next event if you can't compartmentalize and put on a new face and go on to a new event and not fall apart because you're upset about something that happened 15 minutes ago.
Mm.
And it really helps you deal effectively with your patients, not unemotionally, but effectively, so you can be effective. And it's necessary. Where it was bad for me was I talk about a story that I called, um, well, it was a story about my brother. When my brother died, it was about 6 or 7 years ago. And I flew out. I live in the West Coast now, and he's on the East Coast. And he was too young to die. He was in his late 50s and had a devastating, well, he had a heart attack. And no one knew he even had a heart condition. And my family called me. I got on the red eye and I flew right out, hoping that this was just, he was such a jokester that this was just his way of getting me to visit. But I knew it was real, that he'd really had a heart attack. But when I got there, not only had he had a heart attack, but in the midst of the catheterization to do angioplasty to open up his vessels, he had a devastating stroke, an end of life stroke. He was on a respirator. And so I knew as a neurologist what had happened. And um, I also got the distinct impression that the cardiologist did not want this on his record, that it was a stroke that happened during his procedure. He
Right.
wanted to wait. It was a Friday. Let's wait till Monday and see if he
Mhm.
wakes up and see how he is. And then we'll get a neurology consult and deal with it. And I was, no, no, this is my brother. I want a neurology consult. I want an MRI. He's had a devastating stroke. He goes, no, I don't think so. I don't think so. Well, of course he knew better.
Right.
And so I'm kind of calling out the profession there because I knew what was going on, but this was my brother and this was
Right.
not going to happen. But I ended up having to manage the case, manage the fact we have to do this, we have to do that, it has to be today. And it ended up withdrawing care within 24 hours. And they just kind of silently disappeared. And it was up to me to manage my brother's death and to deal with the family. But I was the family as well.
Right.
And it should not have fallen on me. But I had to just go into doctor gear and compartmentalize. And as a result, I went through it all. He died that day, and the funeral, I stayed out in the East Coast. The funeral was a couple of days later, and I just became the one to manage the family and deal with everything. And even at the wake, when, and come from an Irish family, so they were all drinking and, you know, remembering him and what he was like. And I couldn't even touch a glass of alcohol. I had to be the strong one. I had to manage everybody, make sure they all got home okay. And I found that I couldn't cry. I couldn't cry for my brother because I was the doctor. And I just thought it was just so unfair.
Mhm.
I couldn't be his sister in that moment. I had to be his doctor. So that's where it hurt me. But in the end, I was so thankful that I could be there for his family
Right.
because the doctors there were not. And so it was a gift to his family that I was who I was. And it was much later that I could actually come home and remember him and grieve and cry. And even to this day, I'll think, oh, I want to call Blaine and tell him what just happened. He'll really appreciate this. And then I
Mhm.
remember he's not here, and it's
Mhm.
been 6 years. Or one of his daughters will call me, and on the anniversary of his death or the anniversary of his birthday, we all talk on the phone about him because he was a character. Wonderful man. And that's where it's hard because you have to switch back and forth
Right.
when you have to deal with something.
Yes.
Um, and I hope I never have to do that again, but I probably will.
Yeah.
But it's a special superpower that
Right.
you can do it, that you've been
Right.
taught to do it,
Yes.
because it allows you to be effective in your
Right.
work, but you can't. It's difficult to switch and though go back
Right.
and forth and be something else when you need to be.
Right. It sounds like a blessing and a curse in some ways, right?
Yes,
Yeah.
yes.
And I'm so sorry you had that experience with your brother.
Yeah, thank you. Thank you. So it's and even when my mother died, I remember in terms of what societal expectations are, she died. She shouldn't have died. It was not of natural causes. It was a mistake of the physicians. They had made a huge mistake with her, um, a blood thinner they had her on, and she bled uh, fatally into her uh, peritoneal cavity. And as a result of her blood pressure dropping, she had a devastating bilateral stroke to her brain and, went into organ failure. And so realizing that doctors are human at that early stage of my career, how human they were, to have made a mistake, not just a mistake, but my mother
Right.
dying. And then I had to go back I was a resident. So you can't take time off for grief. My mother died on one day. 2 days later, we buried her. And the next day, I was back in the hospital on call.
Right.
And even though I was among other physicians that should know better, I was expected to just, move on. That's over. That was yesterday. Move on. You're on call today and you have to do this and this and this. And I did. I was there. But I was in a fog, just a complete fog for many, many months. And I don't know how I got through the days. I would see a patient and chart on their vital signs and their respiratory settings on the chart. And then I'd look and I'd say, did I put that on the right chart? What patient did I just see?
Mm.
And I'd have to go back and look again and do it again and go back and check the chart and double check it because I had a hard time keeping that in my mind. And
Right.
fortunately, I didn't make any mistakes, but I wasn't entirely there. But there was very little understanding. And on my part too, I was like, "Oh no, I'm fine. I'm fine.
Right.
I can keep doing this," but I wasn't. And so there's very little, I think, knowledge in the general community unless you've lived it.
Right.
My mother gave me that gift that now I look back and say it was a gift, so I understood and was more compassionate with others going through that. But I can tell you my superiors were not very compassionate in the
Right.
particular place I was.
Well, it's interesting because I've heard it said that we are a grief illiterate society, and I wanted to ask you what your thoughts on that were. And just in terms of hearing everything you just said about your own experience with the loss of your mother and your grief, and your brother as well, in the medical context, you would think that of all communities that the medical community would be sensitive to grief because it's part of our human experience and it impacts our health and well-being.
Yes.
Why? So talk to us about that. This whole lack of understanding or willingness to confront grief in the society. What's that all about?
I think it's unique to the United States and um, more of our peer countries economically. We live in this fast-paced environment that we're supposed to just keep going, and we don't talk about death very much. We don't talk about illness very much. unless it hits us and if it affects us. And then we find that nobody around us wants to talk about it. And it's very difficult if you've ever gone through an experience like that and um, someone asks you how you are and you're actually honest and said, "Oh, I'm terrible.
Right.
I just, I just learned this happened or that happened in my family." And they just look at you and they just don't know what to say and they change the subject. They really didn't want you to tell you how you really
Right.
were. They
Right.
want you to say, "I'm fine," and move
Yes.
on
Yes.
because they haven't come to grips with mortality themselves. And so it reminds them that they're mortal, I
Right.
think. And if you haven't dealt with it and thought about it and contemplated it, and I think those of us that have gone through it have, or we've had to, or
Right.
if we haven't dealt with our grief yet, and it's going to hit us because we hold grief in our bodies, um, that we just gloss over it. And it's something we just are uncomfortable with. And of course, it is uncomfortable.
Yes.
But other societies, more primitive societies, I think deal with it much better. They deal with it, death, for instance, as a part of life,
Right.
and they revere the elderly and they revere the dying and they honor them. And I think they deal with the whole process so much better than we do.
Yes. So how could we be doing a better job in this society to get more comfortable with our mortality and be able to be in our own grief and help support others? How can we do a better job at that, do you think?
I think it's with education. And I wish I had that answer because I could fix maybe fix society. Um, it's not easy. You've got I think it helps a lot when people who are well known, like Michael J. Fox and now Eric Dane, who has ALS, that are people we relate to because they're in the movies or we read about them and they're famous. When they get sick or they deal with some devastating illness or loss, when they come out and talk about it,
Yes.
then I think people stop and they listen more. And I think bringing it more to the forefront is helpful. I think talking about it now, there are so many things out there now. There's podcasts and there's books about grief and dealing with grief and things like addiction and how we grieve the loss of a loved one from addiction. And they might not have died, but we've lost them in a sense to addiction. And we need to talk about it. We need to grieve the loss and we need to be open about it and not ashamed.
Right.
I think we're to some extent ashamed of weakness. And we're ashamed to admit that we can't get through the day. All we want to do is cry and that, we're having a difficult time dealing with something.
Right.
Just so many people have that, especially in higher education and in the military, and with athletes, for instance, there's that warrior mentality. We have to just keep on going,
Right.
pick up and go on. But it will get you, and we see it from time and time again. It gets you in the end, whether it's you develop conversion disorder or PTSD or chronic pain, and you don't know where it's coming from.
Mm.
There's a saying about grief living in the body. Have you ever experienced an anniversary? For instance, there's a day that comes and you don't realize it's an anniversary, but you just feel awful all day and you don't know why. You woke up feeling bad and nothing went right. And suddenly that evening, it's been a busy day, you realize, oh my God, this is the anniversary of the death of my mother or my father or
Mm.
somebody, a close friend. And that your body remembers this and your
Wow.
body is feeling it, but you're not conscious of it. So
Mm.
what we're conscious of and what we're not conscious of are two separate things, but the conscious and unconscious both live in our bodies. And
Well,
so we need to be more compassionate with ourselves.
yeah. I feel like too the principle of expectations, the idea of expectations. And so if we have the expectation that we we that we are around our mortality, that life will come to an end, and really integrate that into as your consciousness,
Yes.
then we can deal with it. But in a society where we don't even want to get old,
Right.
right?
Right.
With
Right.
Botox and all these to not age, let alone die.
Right.
It's antithetical to the whole concept of accepting mortality because
It
we
really
don't
is.
want to even get old. Um, I did want to ask you how you chose the stories for the book, the which patients, what was your process? Was it from the journals? And, how did you decide which stories you would use, including your own personal stories that some of which you've shared with us today?
I wanted it to be varied. I wanted it to be across all walks of life, all types of conditions. I tried to put some things in there that were uplifting, like my story about my first night on call as an intern. It was a funny story, but yet it illustrated all the faults in the VA system of hospitals that our poor veterans have to live with. Um, and I tried to put in a funny story there about epilepsy, but every story was something that I thought was illustrative of something like death with dignity or the resilience of someone young at the beginning of their life who learned that they were going to die from cancer or um, medical gaslighting. I tried to reach out to so that there would be something for everybody in these stories. And so I just tried to pick a variety, and they were the ones that were the most impactful to me that I wrote about that left me with a lasting memory that I'll never forget. Um, this story about the little boy who was brain dead from a simple accident with a BB gun that I never forgot. And
Right,
here I am, some of these things that happened, the child might have been the age of my own son. And
right,
here I'm thinking this could be my boy. Um, a young man that was brain dead from using drugs actually looked like my son in bed.
oh, boy.
And these are things that we all live with or know somebody that lived with.
Yes,
The Parkinson's disease, um, the dementia from depression. I thought that would be something that, people think once you have dementia, there's nothing you can do. But here was a case that
right,
was really depression, and somebody just had to dig deep enough to get them into the right hands and get the depression treated because the brain can recover from something like that.
right.
So I tried to make it something that every story was hopeful in the sense that it illustrated how to deal with grief or just seeing the resilience of the human spirit.
Yes, for sure. Yeah.
It was
So,
difficult. I have more stories, and I someday I may, put more to writing, but this was a start, and this was cathartic for me too, to just go back through my career and
yes,
remember these people and honor them in a
yes,
way by telling their story.
yes, yes. You were their doctor, but they were your teachers.
They were my teachers, absolutely,
Yeah,
absolutely.
yeah. So,
Yeah.
what can we learn from your book that could help us be more proactive about our own medical treatment, as well as coming to terms with our own mortality? That's a question that I thought about when reading the book. For me, it's like, okay, I'm looking at all this. What can I do to be more proactive? Because, some of those stories, um, you would hope that if it were you, maybe something you better could happen if the patient had been more proactive. Like, what can we learn from that?
Yeah. Some events are just accidents, and I think we have a
Right.
time that we're meant to go.
Okay.
Um, but I think my story about medical gaslighting was a story about being proactive because it even happened to me. And and I know a lot more than the average person because I'm a physician about medicine. Um, but if you're not, I think we all need to be our own advocates. We need to take care of ourselves, first of all. Someone like my brother, for instance, didn't take care of himself. He was a smoker and he didn't listen to the signs that there might be something wrong. He was in total denial. Um, he was too busy taking care of everybody else. I think we need to take care of ourselves, be compassionate with ourselves,
Mm.
listen to ourselves and our body and take care of ourselves. But I also think if we do reach out to someone and we're uncomfortable with the physician encounter or the provider encounter, whoever that is, and we don't feel like our questions have been answered to our satisfaction, or we still feel symptomatic, but we don't want to go back and bother them. We need to do that. We need to bother them. We need to ask and get our questions answered. And if you still have a feeling that there is something wrong, go see someone else because it was my feeling really that I'm just not happy with that answer. This person that I had trusted for so long, that made me say, I'm not going to wait a year. I'm going to go now. I just
Right.
think something is really wrong here. You need to not question yourself and advocate for yourself. And I think for some personalities, that's hard to do. It's hard to do for the male athlete, military warrior mentality,
Mhm.
but it's also hard for women because they feel like they've been dismissed and um, they don't want to bother somebody and oh, they just think I'm hysterical and I'm a worrier. But women are more likely to get gaslit, and the elderly are more likely to get gaslit than a man.
Right.
So it happens to all of us. And and on a speaking as a physician, the physician isn't doing this on purpose. I don't think it's a malicious thing. I think they get frustrated too when they can't figure out what's wrong with someone and they keep coming back and they think they've done everything and they're frustrated. So they say, oh, it's just stress because they can't, of course, they can't be wrong and they've done everything and they don't want to take it any further. But they're out of frustration, they attribute something to stress. But I think stress will do a lot. But
Yes.
I think you have to make sure there's nothing else there.
Right. Right.
So we have to basically be compassionate with ourselves, listen to ourselves, and be proactive, if that helps.
Yes, very much. Yes. Thank you.
You're welcome.
What is it that you hope that readers will take away from your book, having read your book?
The main message I want readers to take away is that um, these stories illustrate um, grief and um, hope and resilience that connect us all as part of humanity. And I'm hoping that there's enough stories in here that the readers will see themselves in one of these stories to feel that connection with humanity. And also that we are, as human beings, much more resilient than we think we are. And that
Yes.
we think we could never deal with this or that or overcome something, but you'll
Mm.
be surprised just how strong you are.
Mm. I love that. And I think you certainly have accomplished that with this reader in
Thank
reading
you.
your book. So thank you. And what is the best way to find Whispers of the Mind? Where do we
Uh,
find it? How do we get it?
you can get it through Amazon. And it's also available at any bookstore, Barnes and Noble, any of your local bookstores. They might not have it in stock, but they have it through Simon and Schuster, and they can order it. Um, but Amazon is probably the easiest.
Okay.
I hate to promote um, one particular place, but
Right.
it's easy to find it there or Barnes and Noble.
Okay.
Okay.
Wonderful. Yes, I want to thank you so very much. I also want to share with you just being with you during this interview, listening to you, seeing you. I can see your gifts as a woman, as a human being, and as a neurologist. You are absolutely lovely and gifted and
Oh, thank you
kind
so
and
much.
wonderful. Thank you so much. It's a pleasure to talk to you today, doctor.
It's my pleasure.
Thank you.